Treatment of a painful neuropathy with palmitoylethanolamide, an endogenous fatty compound.
I would like to present to you a patient born in 1920, and this patient visited our clinic a few months ago. Her diagnosis was a torticollis. She has had an essential tremor, but the main thing why she came to our clinic was that she suffered from severe pain in the feet, where the pain scores were in between 7 to 10 on a numeric rating scale, where 10 is the most extreme pain one can imagine and 0 is no pain. And the pain was due to a chronic idiopathic axonal polyneuropathy. This diagnosis has been given to her based on neurological examinations in Canada. She lives half of the year in Canada and half of the year in Holland. And while she was in Holland, she visited our clinic. She clearly suffered from severe burning pain, which made it difficult for her to sleep and which made walking also very difficult. When she came to us, her mean score was, as I said, between 8 and 10. We started treating her with a very special compound after we tried some classical approaches, which are parts of our treatment protocol, but she was a non-responder to our normal approach. Then, via a colleague, a professor of neurology in Italy, I received Palmitoylethanolamide or Normast, a compound which is at the moment produced by a company called Likert, and they started the neuroscience project where they evaluate the efficacy and the safety of this food supplement in patients with polyneuropathies and pain, and in general in patients suffering from neuropathic pain. We started treating this patient, a patient from 1920, so meanwhile she is 90 years old, with palmitoylethanolamide, and after the first 2 weeks where the pain scores remained centered around 6 to 8, the pain scores fell dramatically up to 2 to 3 and remained so in the following month when we treated her with palmitoylethanolamide. This is a decrease of pain for more than 50%, and thus we can regard her as a full responder to this very benign supplement. She reported no side effects, apart from the fact that she had the idea that her blood pressure was slightly less. Normally it was 135 over 86, and now it was more 128 over 80. So whether this is due to palmitoylethanolamide or not is difficult to say, but the decrease is just marginally. She has a much higher quality of life and was very happy with the palmitoylethanolamide. Palmitoylethanolamide is a body-owned compound. It's a fatty substance which has resemblance to anandamide, our own endogenous cannabinoid, but the mechanism of action of palmitoylethanolamide is probably a different one as of anandamide.
Here we see the structure of palmitoylethanolamide. Clearly a fatty acid.
Anandamide has a high affinity for the cannabinoid 1 receptor, and palmitoylethanolamide does not have that high affinities for neither the CB1 or the CB2 receptor, but it has a high affinity for the PAR-alpha receptor in the nucleus, and most probably the mechanism of action, the analgesia, you can obtain by giving 2 times 600 milligrams of this fatty acid is due to this mechanism of action called the PAR-alpha receptor mechanism. So far we have treated a couple of patients with this compound and we did not see side effects, but we did see, as in this patient, some remarkable
response.
A patient presentation from the Institute for Neuropathic Pain in the Netherlands.